Hi everybody, my name's Rob. I've never done an unboxing video before, which is why you're going to be seeing this space here. Don't need my ugly mug all over the internet, but I'm going to do an unboxing of a glaucoma treatment. This is a treatment that you may have prescribed if you've been diagnosed with glaucoma, or if you're a glaucoma suspect, or even if you've just got high pressure in your eyes. You will often be prescribed something like this, which is Latanoprost. There are other drugs. They each have their own set of specific side effects, but they all work on the same principle, and that is that what they're trying to do is reduce the pressure in your eyes. Now, if you're a glaucoma patient, then it's not just the pressure in your eyes that they've detected. The specialists have also discovered other evidence, if you like, such as optic nerve damage, cupping, a cup-to-disc ratio of your optic nerve, visual field loss. There's a number of tests that go into determining whether you're a glaucoma patient or not. Pressure is just one of those things that they count. The reason I say that is you can actually have high pressure and not have glaucoma. Similarly, you can have glaucoma and not have high pressure. Right. In the year 2020, the only thing they can do at this point is either surgical intervention or medicated eye drops to reduce the pressure in your eyes. That's the only treatment option available. There's nothing else. Hopefully there will be in the future. And because glaucoma is caused by a number of different things, it's not the best news to find that you're a glaucoma patient, because the only course of treatment at this point is to reduce the pressure in your eyes. But the purpose is to reduce the pressure in an attempt to slow the progression of the disease. I've had friends and family make comments to me because, hey, all I'm doing is putting eye drops in. What's the problem? So I thought what I'd do for their benefit is produce this video. Right. Latanoprost. Here we go. Now, this is a medicated eye drop. It's prescription only. Used to be known as eyesight in New Zealand. Here in New Zealand, it's funded by Pharmac. That's good news, because in other parts of the world, you can pay hundreds of dollars for this. Now, this is a 28-day supply. Normally in New Zealand, we would be prescribed 3 months' worth to coincide with our 3-month checkup at the ophthalmologist just to see how it's progressing. Currently, because of the COVID-19 pandemic, you can only get a 1-month supply, so you've got to sort of stay ahead, you know, because you don't want to run out, because you have to take these drops every night if you've been prescribed them. Okay, first thing you'll notice, 2.5 mil. That's not a lot, is it? And that's got to last you 28 days. So it gives you an idea of the potency of the stuff. What's in it? Well, I'll just go and get my glasses and I'll tell you. Probably should have planned this part earlier because, well, I have glaucoma in both eyes. I also have cataracts, which doesn't help. So my vision's pretty poor. Now, 2.5 mil of Latanoprost, which is a prostaglandin analog, or is it analog prostaglandin? I don't know. I'm not a doctor. But I can also tell you that there's also 200 micrograms per milliliter of benzalkonium chloride. It's a preservative. You can get preservative-free eye drops, but they're not available in New Zealand funded. Right. Now, the first thing you do is open the box. I'm just going to try and hide my personal details there. Right. It's not very big, is it? It's tiny. And in fact, it's not even properly full. I don't know if you can see, because as we said, there's only 2.5 mil. The first thing you notice is it comes with a cap that you have to twist to break the seal and discard. And then, of course, you've got the inner cap on the inside. Now, I'm not going to open this one because once you've opened it, you've only got 28 days to use it. Also, you'll notice you store it in the fridge. You store these little things in the fridge. Once you've opened it, apparently you don't have to put it in the fridge, but I do. I put mine in the fridge, and there's a reason for that. And that is that when you're putting the eye drops in, they don't sting quite so much. And also because they're cold, you know that you actually got the target area. The other thing that's in this box is this. Right. Now, first of all, the irony is not lost on me that if you've got vision problems and you're being treated for an eye disease, why on earth the manufacturers would look at the length of this thing. It's like the credits to Star Wars. And because glaucoma and vision problems can be often age-related, I mean, I'm only in my 50s, so I don't consider myself to be that old. But there's a higher proportion of patients with glaucoma who are older. There's also younger. But how on earth are you meant to read that? And you know what the worst part is? It's on that sort of really thin tissue paper stuff. So even when you see, everything just bleeds through, and it makes it blooming hard to be able to. Anyway, that's your list of precautions, instructions on how to put an eye drop in, and then from about here, there, all the way down here and up here are the side effects. The treatment of putting medicated drops into your eyes for glaucoma actually makes your vision worse, which I find very ironic. Blurry vision and what have you are some of the side effects. So hang on, where's my glasses? Righto, turn her over. Where's my... I've got cataracts too in this eye. So I've got glaucoma in both and cataracts in that one. So, right, side effects. Tell your doctor if you notice any of the following and if they worry you. Righto. Let's race through them. A change in eye colour over a period of time. Yes, that does happen. It's permanent too, by the way. Here's the one that I suffer from quite badly. Blurred vision, double vision, and what they call other visual problems. Latanoprost makes your vision really blurry, and I don't mean when you first put the eye drops in. I actually mean for most of the day. I mean, I have to put my drops in at night, and there's probably a reason for that. If you're asleep, you're not going to notice the blurred vision, but the next day, gee, I tell you what, the first thing in the morning, it can be quite difficult to see. Double vision is not pleasant, seriously. So the funny thing is I didn't have double vision and I didn't have particularly blurry vision when I was diagnosed with glaucoma, because glaucoma affects your peripheral vision first and then starts to narrow down your field of vision, and you end up with blind spots and things like that and sensitivity to light. So you're dealing with that, and then suddenly you get prescribed this to bring the pressure down, which makes your vision worse as a side effect. I guess that's better than the other side effect of not taking them, because that side effect would be losing your vision. Feeling like you've got something in your eye. Eye pain, redness, burning, watering of the eyes, discharge, itching, thickening of the eyelashes. Yeah, well, that's happened, but hey. But I'm a mid-50s male. I don't need really long eyelashes. Darkening of the skin around the eyelids, crusting, redness, itching, sensitivity to light. Now, I've got to be honest. I'm not sure whether the sensitivity to light that I have is caused by the glaucoma, or whether it's caused by the drugs. You know how some cars travel in the daytime with their running lights on, or their park lights, or even their headlights on a gloomy day? If I'm in a car and we're approaching a car coming in the other direction and they've got their lights on, I actually have to turn my head away. have to shield my eyes. It's actually quite bright. It's like somebody shining a torch straight into your eye. It is bizarre, and it's frustrating, and it's even a little painful. There's also other side effects like skin rash, headache, painful, urgent, or frequent urination. Ooh, that doesn't sound pleasant. And this one, muscle and joint pain. Now, I know what you're saying. Those are the common side effects. I'm not going to go into the serious ones. You're probably thinking, how do you get joint and muscle pain from putting drops into your eyes? Well, it's pretty basic. There's several ways for things to get into your system. Several ways, okay? Let me explain this. There's your mouth, your nose. You can inject straight into your skin, into your bloodstream. But the other way into your system for things to get in, hey, and we're talking about things like viruses and drugs and whatever else. The other way for things to get in is through your eyes. Your eyes give a direct pathway for the drugs to get into your system. In fact, part of the instructions of using Latanoprost is once you've put the drop in, is you're supposed to hold your finger in the corner of your eye where your tear duct is. It's what they call occlusion, in an attempt to prevent it getting into your system. It still gets into your system. I'm in my 50s, I'm a bloke, so I get those anyway. But since I've been on Latanoprost, it's been worse. Sometimes I just feel as though I've woken up with the flu. Yeah, that's literally how I feel. That's the best way I can describe it. And it lasts most of the day, as does the blurred vision and the double vision. Starts to clear near the end of the day, and that's to do with the fact that with my drops, I'm to take them at night, in the evening. A couple of other things to cover. What I tend to do as a bit of a trick is keep my drops in the fridge, because it makes them cold. And look, if you can imagine, you're in a position like this above your own eye, trying to drop the drop into your eyeball. Having it cold helps me realise I've actually got the drops in. Okay, if that makes any sense. Other than running down my cheek or into my forehead. In fact, sometimes you know that a drop's come out, but you've got no idea where it went. So having it disappears. Having them cold does help. Another trick, because you've got 28 days, I tend to write on the box when I open it. Because the last thing you want to be doing is putting in expired drops into your eyes. So basically, that is Latanoprost. If you're experiencing any of those side effects, then I really do feel for you. They're not pleasant. Not everybody gets the same side effects. I know people around the world who are on these drops who have no side effects at all. And it can be incredibly frustrating for those who do have the side effects that are trying to cope with it. I guess there's a bit of an understanding expected from your family around you, because they don't directly know or even understand the disease to begin with. And trying to explain that putting tiny little drops into your eyes can cause so many side effects. So all the best if you're on your glaucoma journey. I hope you take heed of a little bit of advice. Keep taking them. Keep putting them in your eyes as prescribed. The alternative is worse, right? And try and be a little understanding of those around you. That, hey, how can an eye drop affect your entire system? Yeah. So there you go. Good luck if you're a glaucoma patient. If you're a glaucoma suspect, stick to the medication, all right? It may, in fact, stop you or prevent you from becoming a patient. That's the best outcome. And if you've got a family member who's on either Latanoprost or any of the other medicated eye drops, just remember, they're not just eye drops. These little suckers go right into your system. And that person's probably feeling a bit rubbish as well because of these. See you later. Have a good time.